Reading Howard's story really made me pause and think about how often I brush off the little things my body tries to tell me. I'm in my late 60s now, and like many people my age, I've had my share of aches, twinges, and odd sensations. There was a time last year when I had this persistent itching on my upper back, nothing dramatic, just annoying. I thought it was dry skin, or maybe my laundry detergent, so I tried switching soaps, changing clothes, even sleeping without a shirt. Nothing really helped, but I didn't say anything because honestly, it felt too small to mention. Now, after hearing stories like Howard's and others in this video, I realize that ignoring those subtle signs might mean missing something serious. What I've learned and what I'd advise anyone my age is this: don't assume everything is just getting old. Yes, aging brings changes, but persistent symptoms deserve attention, especially when they linger for weeks or don't respond to basic care. Whether it's an itch fatigue or a strange feeling that just won't go away, it's worth bringing up with your doctor. And don't let embarrassment keep you silent. Our bodies speak in whispers before they scream, and those whispers, like Howard's itch, can sometimes save your life. So now I pay closer attention. I keep a little notebook and jot down anything that feels off or new. I remind myself that early detection often starts with awareness, and that my health is worth speaking up for, even about the little things. Thank you for staying with us until the end. If you found this video helpful, insightful, or even just a little eye-opening, please let us know. If you thought it was good, comment the number 9 below. We'd love to see how many of you are out there paying attention to your health. And if it wasn't quite what you expected, go ahead and give us a like instead. Either way, your engagement helps this community grow and brings more awareness to these silent but important signs that often get overlooked. Remember, listening to your body doesn't make you paranoid. It makes you proactive. That one small itch, one subtle change, could be the whisper that saves your life. So don't ignore it. And don't forget to subscribe and hit the notification bell so you never miss videos that truly matter. Stay safe, stay informed, and we'll see you in the next one. Sign number 1, persistent itching on the lower legs, especially in the shins and calves. For many older adults, this can start without warning. There's no rash, no dryness, no new soap, and no detergent change. It's just there, constant, lingering. And lotions don't make it better. In fact, sometimes they don't do anything at all. This very specific type of itch has shown up in many patients later diagnosed with blood cancers, most notably lymphoma. It's not the kind of itch that comes and goes. It's relentless, often worse at night. It burrows under the skin like a whisper you can't silence. Why does it happen? The science behind it traces back to the immune system. Cancers like Hodgkin's lymphoma begin in the lymphatic system, which is a core part of the body's immune defense. As cancer cells spread, they release inflammatory chemicals into the blood. One side effect of these chemicals is a deep, sometimes burning itch, especially in the lower extremities. Even when the skin looks normal, the nerves underneath are irritated from within. I want to tell you a story about a man named Harold, age 72, who lives in a quiet suburb outside of Portland, Oregon. He's retired, used to spend his mornings gardening and his evenings walking his dog Jasper. A simple, peaceful life. One day, Harold started experiencing a constant itch on the front of his legs, just below the knee. At first, he thought maybe it was new grass in the yard, maybe insect bites. He tried switching soaps, wearing different pants, applying aloe vera lotion. Nothing worked. Weeks turned into months. The itching didn't stop. It got worse at night. He found himself awake at 3 a.m., sitting on the edge of the bed, scratching until his skin turned red, even though there was no rash. His wife, Susan, finally urged him to see a doctor. At first, the physician thought it might be contact dermatitis. But when the usual treatments failed and some basic blood work showed slightly elevated white blood cell counts, they dug deeper. A scan revealed enlarged lymph nodes in his abdomen and chest. The final diagnosis, stage 2 Hodgkin's lymphoma. Harold told his family later. The itching came first, long before I felt tired, long before I had any idea something was wrong. His story, unfortunately, is not uncommon. While not every persistent leg itch means cancer, there are a few key differences to watch for. If there's no visible rash, no clear trigger, and especially if it's been going on for more than a few weeks, it's worth getting checked. And if it's paired with other subtle symptoms like unexplained weight loss, night sweats, or just a deep sense of fatigue, it's time to ask for blood work and imaging. As we grow older, the body doesn't always scream when something's wrong. Sometimes it whispers. Pain may not come right away. Lumps might be too deep to feel. But the nerves, they respond. And in many cases, that response shows up as an itch, persistent, unrelenting, and strange. If you or someone you love has been dealing with this kind of itch, especially in the lower legs, and creams aren't working, don't ignore it. Bring it up. Ask your doctor to look closer. Mention the pattern. Because sometimes the earliest sign that something serious is happening is something as small as an itch. How could something deep inside your body, like the pancreas, cause a mysterious itch high up on your back? It seems odd at first, doesn't it? But here's the reality. When a tumor begins growing in the pancreas, it can gradually block the bile ducts, those tiny but essential channels that carry bile from your liver to your intestines. Once those ducts are even partially obstructed, bile salts begin to back up into the bloodstream. And one of the earliest, most overlooked symptoms of this buildup isn't pain. It's itching, intense, confusing, and completely resistant to creams or lotions. There's a man I met once named Walter. He was 74 and lived in a quiet coastal town in Oregon. He had always been a healthy guy, didn't smoke, kept active walking along the beach every day. One day, Walter started noticing a strange itch right between his shoulder blades. At first, he blamed it on his sweater, then maybe the laundry detergent, but the itch didn't go away. It got worse, so persistent, so irritating, it would wake him up in the middle of the night. He described it as a crawling sensation, like something was buzzing just under the surface of his skin. And no matter how much he scratched, it never felt better. He tried everything. Switched shampoos, stopped wearing wool, even got a new mattress. But nothing helped. There was no rash, no redness, no visible sign that anything was wrong. Just that same deep haunting itch day after day. It wasn't until he went in for blood work during a routine checkup just to talk about feeling a bit more tired than usual that his doctor noticed elevated liver enzymes. That led to further testing, and a scan revealed a small tumor in his pancreas pressing directly on the bile duct. That itch had been his first and only warning sign. No pain, no digestive issues, no yellowing of the skin or eyes, just that unrelenting sensation on his upper back. Walter caught his cancer early because he chose to listen, to trust his body when something didn't feel right, even if it seemed small. That's why this location matters so much. Yes, an itch on the back can come from dryness or friction, but when it's focused in one spot deep under the skin and won't go away, especially when paired with other vague symptoms like darker urine, pale stools, or fatigue, it may be your body trying to speak louder. For older adults, this kind of subtle sign is easy to ignore. We don't want to sound like we're overreacting. We don't want to be a bother. But your body is wise. It remembers everything. And sometimes it sends quiet warnings before bigger trouble arrives. Think of it this way. Your back, especially the space between the shoulder blades, is rich with sensory nerves. It's a communication hub. And when something like bile salts irritate those nerve endings, you feel it in places that don't seem obvious. It's not random, it's biological. It's your body connecting dots in ways you may not expect. Walter's story isn't the only one. Over the years, many older adults have shared similar tales of itches that led to answers. Some caught problems early, others didn't. The difference, whether they paid attention, whether they believed that something as small as an itch could matter. So here's what I want you to take away from this. If you or someone you love has been dealing with a deep, strange, unexplainable itch on the upper back for more than a couple of weeks, don't ignore it. Don't assume it's just dry skin, especially if nothing's helping and you've tried everything. Speak up, ask your doctor, request blood work. Bring it into the conversation. You may feel silly at first, but what if that tiny itch is your body's only way of waving a red flag? What if listening now could spare you greater pain later? That's not being dramatic. That's being wise. That's being proactive. That's giving your body the respect it deserves. If you've been watching this video and still with me, I want to know, have you ever experienced an itch that just wouldn't go away? Especially one in the same spot day after day? If so, comment number 2 below to let me know you're here and paying attention. And if you haven't already subscribed to this channel, please do so now and tap the bell icon. We're here to bring you important insights, information that could help you or someone close to you avoid unnecessary suffering. We're not about fear, we're about awareness, about acting when your body speaks, even in whispers. Let's continue. The next sign is one many people experience but rarely understand: fully persistent itching on the scalp without any visible flakes or redness. It might seem like a small annoyance, but for some, it's the first sign of a much deeper concern. Sign 4: persistent itching on the chest or breast area. In the quiet town of Asheville, North Carolina, nestled amidst the Blue Ridge Mountains, lived Margaret, a 68-year-old retired school teacher known for her vibrant spirit and love for gardening. One spring, Margaret began experiencing an unusual itch on her left breast, just below the collarbone. At first, she attributed it to the new laundry detergent she had recently started using, or perhaps the snug fit of her gardening overalls. She switched detergents, opted for looser clothing, and even applied various creams, but the itch persisted. Margaret's days were filled with tending to her roses and reading novels on her porch. But the nagging itch became a constant companion, especially during the quiet evenings. There was no visible rash, no redness, just an unrelenting itch that refused to subside. Concerned, she scheduled an appointment with her primary care physician. The doctor conducted a thorough examination but found nothing alarming. Nevertheless, he recommended a mammogram to rule out any underlying issues. The mammogram revealed an area of concern, leading to further tests, including an ultrasound and a biopsy. The diagnosis was unexpected inflammatory breast cancer, IBC, a rare and aggressive form of breast cancer that often doesn't present with a distinct lump. Instead, IBC can manifest through symptoms like persistent itching, redness, swellings, or a feeling of warmth in the breast. In Margaret's case, the itch was the sole indicator. IBC progresses rapidly, often within weeks, and can easily be mistaken for less severe conditions like infections or skin irritations. It's crucial to recognize that symptoms such as persistent itching, especially when localized and unresponsive to typical treatments, warrant medical attention. Early detection is vital, as IBC is typically diagnosed at an advanced stage due to its subtle and deceptive symptoms. Margaret's proactive approach in seeking medical advice, despite the absence of more common symptoms, played a pivotal role in her early diagnosis. She underwent a comprehensive treatment plan, including chemotherapy, surgery, and radiation therapy. Her journey was challenging, but her resilience and the support of her community helped her navigate through the ordeal. It's important to note that while IBC is more common in women, men are not exempt. Male breast cancer, though rare, can present with similar symptoms, including persistent itching, nipple discharge, or changes in breast tissue. Men often overlook these signs, attributing them to benign conditions, which can delay diagnosis and treatment. Wikipedia +2 Health 2 American Cancer Society +2. Another individual, Thomas, a 72-year-old retired carpenter from Ohio, experienced a persistent itch near his right nipple. He dismissed it as a minor irritation from his work clothes. However, when the itch persisted for over a month without relief from topical treatments, he consulted his doctor. Further examinations revealed early-stage male breast cancer. Thomas's story underscores the importance of awareness and prompt medical consultation regardless of gender. In both cases, the common thread was a persistent, unexplained itch that didn't respond to conventional remedies. Such symptoms, especially when localized and enduring, should not be ignored. They may be the body's subtle way of signaling an underlying issue that requires attention. If you or someone you know experiences a persistent itch on the chest or breast area, particularly if it's unresponsive to standard treatments and accompanied by other changes like swelling, warmth, or skin texture alterations, it's imperative to consult a healthcare professional. Early detection and intervention can significantly improve outcomes. Remember, our bodies often communicate through subtle signs. Listening to these signals and acting promptly can make all the difference. Stay vigilant, stay informed, and prioritize your health. It turned out to be an early-stage tumor, something that could have silently advanced if Howard, a 74-year-old retired mechanic from Dayton, Ohio, hadn't trusted his gut. For months, Howard had battled a constant itch in the most uncomfortable of places, his groin area. He chalked it up to heat age and the new incontinence pads he'd started using after a minor surgery. He was embarrassed to talk about it even with his doctor. It just felt awkward, he later admitted. But the irritation wouldn't go away. It worsened at night, burned during the day, and never fully responded to any of the creams or powders he tried. Eventually, it was his wife, Marianne, who insisted he get checked. She said, "If it's nothing, we'll sleep better. But if it's something, we need to know." A biopsy confirmed early anal cancer. Fortunately, it hadn't spread. The doctor told Howard that his decision to speak up despite the discomfort of the topic made all the difference. And that truth doesn't just apply to men. For older women, a similar itch in the genital area can point to vulvar cancer. While relatively rare, it becomes more common after age 60. And one of its earliest signs is a stubborn recurring itch on or near the outer vaginal area. The skin might not show any obvious signs, no lumps, no lesions, but it can start to feel rougher, thinner, or discolored. Many older women blame hormone changes or postmenopausal dryness, and sometimes that's all it is. But when itching won't stop, when it worsens at night, and when no lotion or ointment brings relief, it should never be dismissed. This part of the body holds a dense network of nerve endings. It's sensitive, which means it often picks up on internal changes long before other symptoms show up. It might be inflammation in lymph nodes. It might be changes in the skin cells. Or it might be something more serious quietly developing below the surface. The tricky part is this: many people don't say anything. They feel shy, or they worry it's nothing and don't want to seem dramatic. But silence can be dangerous. Speaking up might feel uncomfortable, but it could be the step that saves your life or the life of someone you love. Howard's story is a reminder that instincts matter. You don't need visible proof for your concern to be valid. Sometimes it's the quiet, persistent signs and itch that won't leave that carry the loudest warning. The big takeaway here: if an itch doesn't go away, especially if it's concentrated in one area, don't brush it off. Don't just keep putting creams on it and hoping for the best. Let a healthcare provider take a look, because many cancers that are caught early can be treated successfully, and that often starts with you noticing something small, something unusual, and choosing not to ignore it. As we approach the end of this video, I want to remind you, your body is always trying to communicate. Sometimes it whispers before it ever shouts. It's your job to listen, and we're here to help you understand what to listen for. If this video resonated with you, or if you've learned something new, please comment number 4 below. It helps us know you're here and engaged. And if you haven't already, hit that subscribe button and turn on the bell for more life-saving health insights just like this. You're not alone, and you don't have to navigate aging in the dark. We're with you every step of the way. Reading Howard's story really made me pause and think about how often I brush off the little things my body tries to tell me. I'm in my late 60s now, and like many people my age, I've had my share of aches, twinges, and odd sensations. There was a time last year when I had this persistent itching on my upper back, nothing dramatic, just annoying. I thought it was dry skin or maybe my laundry detergent, so I tried switching soaps, changing clothes, even sleeping without a shirt. Nothing really helped, but I didn't say anything because honestly, it felt too small to mention. Now, after hearing stories like Howard's and others in this video, I realize that ignoring those subtle signs might mean missing something serious. What I've learned and what I'd advise anyone my age is this: don't assume everything is just getting old. Yes, aging brings changes, but persistent symptoms deserve attention, especially when they linger for weeks or don't respond to basic care. Whether it's an itch fatigue or a strange feeling that just won't go away, it's worth bringing up with your doctor. And don't let embarrassment keep you silent. Our bodies speak in whispers before they scream, and those whispers, like Howard's itch, can sometimes save your life. So now I pay closer attention. I keep a little notebook and jot down anything that feels off or new. I remind myself that early detection often starts with awareness, and that my health is worth speaking up for, even about the little things. Thank you for staying with us until the end. If you found this video helpful, insightful, or even just a little eye-opening, please let us know. If you thought it was good, comment the number 9 below. We'd love to see how many of you are out there paying attention to your health. And if it wasn't quite what you expected, go ahead and give us a like instead. Either way, your engagement helps this community grow and brings more awareness to these silent but important signs that often get overlooked. Remember, listening to your body doesn't make you paranoid, it makes you proactive. That one small itch, one subtle change could be the whisper that saves your life. So don't ignore it. And don't forget to subscribe and hit the notification bell so you never miss videos that truly matter. Stay safe, stay informed, and we'll see you in the next one.